All right. Welcome. Welcome in, folks. We're just going to give people a couple minutes to join. We are recording this talk so people can watch later. So we just want everyone to be aware of that. We just ask that people mute themselves during the talk. All right, it's 11:05, so we're going to get going. Welcome, everybody. My name is Dr. Sarah Tenenbaum, and I'm the Senior Director of Outpatient Clinical Services here at the Baker Center. And I'm really, really excited to kick off this new educational seminar series that we've put together, really just to help bring some research-based information to all of you and our community. There's a lot of information out there. It's hard to sort of know what to listen to and, the stuff that really works. And so we've designed a number of different topics to talk with folks about that are things that come up for us frequently and that we think might be relevant for parents, caregivers, anyone working with children. We're also looking for suggestions from the community about different topic areas that you'd like to hear us and our clinicians chat about. So there's going to be information at the end of the presentation on how to sort of give us some suggested topics. I think there was some information on your registration as well. So we're really looking forward to getting feedback from you. So welcome. We will be taking questions. We'll leave about 15 minutes at the end for any questions that you have, but we ask that you type them in the chat. I'll be sort of gathering them and saving them for Dr. Geary, but please do not unmute and ask questions during the talk so she can sort of get through her material and then leave it open for discussion at the end. Okay. All right, excellent. Well, it's my great pleasure to introduce Dr. Megan Geary, who is the Assistant Director of the Training Institute and a Senior Staff Psychologist here at the Baker Center. Dr. Geary has a really long history of working with children, adolescents, and families, over 15 years of doing this really, really important work. She specializes in evidence-based treatments for children, adolescents, and caregivers. And she's really pretty expert at managing school refusal. When I just think about some of the difficult clients that she's worked with, she's really helped people who had a long history, a really entrenched history of school refusal, get back to school, enjoy school, and be able to live their lives again. And this is a really tough topic that we don't spend enough time talking about. Lots of people are like, what is school refusal? I never even heard that term. So we're going to really learn a lot from Dr. Geary today, a little bit about what it is, what it looks like, and most importantly, sort of what to do about it. So Megan, I will turn it over to you.
All right. Can everybody hear me okay? You can see my team. Yay, head nods. All right, so we're going to start off, like Dr. Tannenbaum mentioned, talking about what is school refusal. I think a lot of people have, very specific thoughts about it, very specific assumptions about what school refusal is. And so we're going to talk about a lot today and kind of how we conceptualize school refusal and what that looks like for many children and the children that we treat at our clinic. So school refusal, the simple definition is that it's when a child or teen has a hard time getting to school or transitioning to school. It could also be that they have a hard time remaining in class. These are our frequent flyers to the nurse's office. That might be some of the first signs that you're seeing. Or that a child or teen has a hard time remaining at school. So we might get those teenagers who are texting their parents in the middle of the day to come home, children going to the nurse's office asking, can you call my mom? I don't feel good. I need to go home. So, examples also might be that we see kids who are maybe whining, emotionally upset, things like that before going to school and when getting ready for school. So it can present in a lot of different ways, and we'll talk more about that. Why it matters, obviously, this is a really important topic. It does impact anywhere from 1% to 5% of school-aged kids and teens. It is more common in our 5 to 11-year-old or elementary age population. And at least 25% of kids and teens will try to engage in some form of school refusal or attempts to stay at home or leave school at some point. So 25%, that's a big number. 1 out of every 4 kids will attempt to stay home at some point for different reasons. It matters a lot too, because when children miss school, they miss a lot of school content potentially and curriculum. That makes it harder for them to go back. They may have a hard time catching up after that. They may feel really uncomfortable that they don't know, what was done yesterday. So even one day, especially as you get older, can make a really big impact on the child's anxiety and ability to return to school at that point. Also, missed opportunities for social connections. This is a really big one for the children and teens I work with too, especially when they're starting to miss school from the very start of the school year. They're missing those really initial critical days of making positive peer connections that may actually motivate them to go to school. But if they're missing that, then that's really concerning and can make this problem even more difficult to manage. It's also, let's just be honest, super disruptive for families and parents. It's stressful as parents and caregivers when our kids are, whining and complaining, maybe being non-compliant, maybe even saying my stomach hurts, my head hurts every single day before school, or often before school, or parents are getting phone calls to come pick their child up. This is really stressful for families, especially when we have 2 working parents, which we often do nowadays. This can be a really big impact on families. Another piece of it too is that when children and teens start to stay home, when as parents we want our kids to feel better and feel good, we may let them stay home, and sometimes that sends the message to the child that they can't cope with it or may have a hard time dealing with it. So this goes to that progression of school refusal, where it often can start small. We might see small instances of behavior or physical complaints or worries. And then if the child's able to stay home or the teen stays home, what we typically see, and it's pretty predictable, is that it will get worse over time. And so we'll talk more about that too. And again, this can really present in a lot of different ways. Common signs of school refusal can be physical complaints, not feeling well. It can be disruptive behavior, children who are throwing tantrums, being very non-compliant, emotional upset or distress. So you might see some, pretty typical, what we would call tantrums, whining, crying, screaming, that kind of thing. And expression of anxiety, worries, and fear about going to school is also very typical for these kiddos. That's one of the most important pieces that we're going to talk about, is that every child and teen is very different. The reason behind school refusal and difficulties attending or staying in class can really vary between child and teen. This can be a really important component of treatment and really helps us figure out recommendations for kids, because we may provide some different recommendations for a child who is being bullied and therefore not wanting to attend school versus a child who is really anxious and not wanting to attend school. Common anxiety or worries that we see, even those can be pretty different. I've worked with a number of children with school refusal, and I always say we can never assume that we know why. We need to ask, we need to assess, we need to find out for that individual child or teen. And this is going to be a big point that I want to make today, is that it's not school truancy. It's not that a lot of these children are just skipping school. They're not engaging in quote unquote bad behavior. What we're seeing is that kids are really having a hard time getting to school for different reasons, these underlying potential reasons. Anxiety and worries. I've worked with children who their main fear was going to school and having to interact with their peers. Social interactions. What if people don't like me? I'm not sure, my friend was mad at me yesterday. I don't want to see her today. That might result in school refusal. Another thing that I've seen often is I didn't do my homework last night, or my homework is not quite as good as I thought it would be, or I'm behind in my schoolwork and I don't want to face my teachers. I don't want to go in because I'm worried about that. Another worry I'll see often is one that comes up with particular assignments that day. I'm supposed to have a presentation. I have this big test. My stomach hurts. I really can't go to school today. So really avoiding that. And another one I've seen a lot is when children and teens are really concerned about interactions with their teachers. So it could be social interactions. It could also be adult interactions. That doesn't necessarily mean something negative has happened. But a lot of kids we work with get really concerned and worried about like kind of being evaluated, and like, I really want to do the best for my teachers. What if I get in trouble? I don't want to have to advocate for myself with teachers. That makes them really anxious. In the category of mood disorders, what I most often see is that we're seeing depressive symptoms. So it doesn't even need to be a full-on diagnosis of depression as we think of it. It could be depressive symptoms that can really significantly impact children, and especially teenagers, where they're having a really hard time getting to school. They may feel really tired, lack motivation to get out of bed. They also have, unfortunately, a really negative outset or like outlook on life sometimes, where they're thinking, why would I go to school? Things aren't going to work out for me anyway. I'll just stay in bed. I'm tired. So we really want to figure out what's happening with this child, with this teen. How were they functioning before? What does it look like now? So we can figure out, the best treatment recommendations for them. And obviously, another big component of this that I've seen is when bullying or significant teasing or negative peer interactions are happening at school. I've had a number of children who were happy to attend school and really enjoyed going, and became the target of peer bullying them. And then they start saying, I don't want to go to school. It's very anxiety provoking, and obviously very concerning as a parent and caregiver. So this is another piece that's really stressful, and needing help navigating the school system for these types of situations. And also really important to listen to your child and teen and find out what's going on so that we can help the best way that we can. This is why one of the first steps of really, really good, effective, worth your time and money school refusal treatment is a good assessment of why it's happening, because that's what we need to know in order to make a plan. So obviously everybody's here today because you guys want lots of information, and wonderfully, there are some really great things that you can start today at home. I know a lot of kids, my kids started school yesterday. A lot of kids are starting right after Labor Day. So get ready. We believe in you. Some of the things that you can do right off the bat at home, I mean, these are going to sound simple and are really important. Be positive about school. Prepare them for school, talk about what's going to go well, what are they looking forward to. For kids who are anxious, and even just typically developing children, starting school is anxiety provoking right at the beginning of the year. Who's going to be in my classes? Do I know where to go? Who's my teacher? So really pointing out for your child all the stable and consistent things at school, like, yep, you're going to the same building. Remember, you're going to see these familiar faces. If it's a new school, definitely attend those open houses or get school tours. Really make your child comfortable there, your teenager comfortable, and being positive about it. So even if the child might be complaining or saying, I hate this, I don't want to go back, that might be a good time to redirect and say, why don't you tell me one good thing about school? Is there anything you're looking forward to at school? Maybe we even plan a special, like, first day of school celebration for when you get home. What's a special treat you want to have when you get home? Praise is another huge part of this. So we want to praise the child for getting ready in the morning, for going to school, for facing their fears. We want our praise to be really, really specific. So not just like, great job, but great job getting out of bed. I know this is hard for you. I'm proud of you for getting ready on time. Great job, coming down to the bus stop with me. So really praising that child kind of every step of the way, in going to school. And those are things that we can do even when we're not sure that our child's going to refuse school. Even if they're just a little nervous, it just feels really good to be praised. Sarah, my boss, Dr. Tannenbaum, praises me all the time. It's like the best thing in the world. We also want to reinforce our kids and reward them for going to school. So sometimes that means, like I said, it might mean like, oh, we're going to plan a special treat after this first day of school. We just really want to make it a positive experience right from the start. As the school year continues, we might make a more structured reinforcement or reward plan. I have a kid, she's amazing, that I have been working with for a while. She went from attending school maybe twice a month to pretty much every day by the end of the school year last year. Yay. And one of her big reinforcers was that she could earn points for attending school, and she would go to a local cheese shop. She loves cheese, which I totally do as well. So whatever your child likes, really finding something they enjoy. Maybe it's a cheese shop. Maybe it's like a trampoline park. I have a lot of kids that earn points that add up for a trampoline park trip. And a big part of this is that we really want to prevent the cycle of if we can prevent it from the beginning, like, let's not even go down this road. That's your best bet of, nope, we're going to get to school. And knowing that if your child stays home and they're not truly sick, and it is for school refusal reasons, then it's going to be a lot harder to get them back the next day. That's the cycle that we want to prevent, is this kind of decrease in functioning, this increase in anxiety that's going to come with staying home rather than getting to school. Another big piece of it that I actually forgot to put on this slide, I'm thinking of my little baby girl, my daughter, who started having some school refusal for preschool. One of the things that really helped her, we would do, not we, my husband, who is on this call, big shout out. he started doing relaxation with her every morning and yoga with her every morning. And it was just a way to get her baseline anxiety down. And then we did lots of praise and reinforcement systems for getting to school. And we were able to get her to school, preschool every day, didn't miss a day, despite some pretty significant school refusal for her. And good news, she started first grade, no school refusal this year. Yay. Guys, it works. I'm telling you, I do it with my own children. You know, it works. So moving on. So those are some big things that you guys can start at home. Oh yes, last one. If they do stay home, we don't want it to be super fun and reinforcing. If they're saying, I'm not going to school, whether it's non-compliance, whether it's anxiety, either way, we really want to make it so that home is not like the best place ever to be. We actually want to obviously encourage our kids to go to school, and we don't want to be competing with their school attendance by saying, well, if you stay home, you get the whole day of video games, the whole day of YouTube. So really working to decrease reinforcement when they're home, making sure they're getting their schoolwork at home, they're not getting extra special time with caregivers or special trips to the store or the park. If you're starting to see a pattern of school refusal, especially really cutting out those things and saying like, well, if you're not going to school, you have to do your work here and it's not going to be fun. Doesn't have to be punishing, just needs to not be fun. So in looking at ways to really advocate for your child at school, this is going to be a huge component of this. One of the big things, again, I'll emphasize this again, we really need to know why the child is or teenager is refusing school. That way we can set a good plan and provide school staff with information about your child or teenager. If the school staff do not have that information, then they can make all sorts of assumptions about why your child isn't attending school. Maybe they feel like, oh, parents just aren't trying hard enough. Maybe they think, oh, Johnny just really, he skips classes, he's truant. When you as the parent may recognize, no, Johnny is really scared of, coming into contact with this other kid who has, pushed him in the bathroom. So this is really important. And, I think it's important for families to be able to maintain their own privacy and how much information they want to share with the school. And this is a time where I say, I think it's really helpful to provide some of this information to the school, especially a lot of the families I've worked with have gotten to that point where they're receiving letters from the school, your child's missing too many days. Maybe the teachers have reached out or school staff have reached out to ask what's going on. And being very honest, I've had children who have been referred to services for truancy or who've had, potential legal actions or the Department of Children and Families called when their child's not coming to school. And I think typically that is happening because the school is concerned and they don't have the information they need to really make a good plan for the child. So we do, in using, it's the same types of behavioral principles that we use at home with our kids, but we can make a plan with school to really, praise arrival of the child at school, praise them for remaining at school. There's the potential to use reward and reinforcement plans at school as well. So whether that reward and reinforcement is not just praise, it's a very powerful tool. But whether it's praise or whether it's also like wow, if you make it to school by this time, you get to have a special lunch with your favorite teacher. Or you get to, shoot basketball hoops with Miss So-and-so. Sometimes that can be really helpful to get kids into school and also really increase their positive interactions and associations with school. We also want to let schools have information about our child so that the teachers and school staff know how to handle situations that come up with your child or teen. For example, making a return to class plan. So for those frequent flyers, which is my other child, we were in really good communication with the school nurse. And we said, unless it's a fever, send him back to class. Feel free to decrease your attention to him and really only praise him when he's ready to go back to class. And the school nurse worked really well with us and was able to do that. And this can be really important too for teachers. When I tell my kids' teachers, hey, if they seem really sick, of course, send them to the nurse. Of course, give me a call. If you're not really sure, feel free to tell them, go get a drink of water. And then, revisit that later. Don't ask them, just see if they come up with that again later. That might be a good plan to give the teacher and the nurse permission to keep your kid at school. And because teachers are really lovely humans. And so they really want to take care of these kids. Same with school nurses. And they may be much more willing to call you or send your child home if they don't have express permission from caregivers and parents to say, actually, that's not really helpful for my child. I really want them to stay at school. We need to praise and reinforce them for staying there. Now, that making a return to class plan can be very specific and individualized for each child. I do think this is where you can try some of those kind of basic strategies. And then if you're finding that it's still, difficult and you need something much more specific, then working with a therapist or working with someone who specializes in school refusal and especially cognitive behavioral therapy and behavioral treatment can be really helpful to really see how we can motivate the child to go back to class, go back to school, and really increase their attendance and their hours in the classroom. We also really advocate for parents knowing the school's procedures and your right as a caregiver. This can be really important. Again, if schools don't have information that they need, they may not make the same assumptions about the behavior of school refusal in your child or teenager as you do. So having that good communication, but also knowing that you can call a school meeting to discuss any concerns that you have about your child at any time. You can call that school meeting and you can ask the school to create a plan for your child. And simple things like, we really want the school to formally document that plan and provide you with a copy. That way, everybody's on the same page. And this even goes into determining if a child needs more supports or accommodations, like a 504 accommodation plan, potentially even an individualized education program or IEP, depending on the severity of what's going on and the intensity. And again, I'll emphasize my biggest concern that I have seen on multiple occasions in different places that I've worked is that sometimes these children or teenagers are considered behavior problems only. They're being truant, they're skipping school, and I really advocate against looking at this behavior in that way. Yep, some kids do skip school. And most often, especially with the young kids, but with teenagers as well, more often there's something much more going on underneath the surface. And if we just think our child is being truant, we're not really addressing the concern, which could be anxiety, it could be depression, it could be bullying that has not been shared with you. Oh, right. So treatments at work. So everything that we have really been talking about, I have been talking about here, a lot of these are cognitive behavioral and behavioral therapy techniques. So behavioral therapy is really where we're working hard to, we don't call it bribery, we call it motivation. I always say we motivate children and teenagers, all human beings. We do things that work for us. We do things that make us feel good or get results that we like or we need. So we're really working on that and helping parents to really advocate for their child. Is such a big component of this, and having the parents understand how our behaviors change and what we do, and then really using that to motivate and praise and reinforce our children and know that. So for example, we know that for children with anxiety about school, they're being very, very reinforced and rewarded by actually escaping the school environment and avoiding that anxiety. And so these are things that we would go over with every individual parent and family and say, okay, we're determining this is what's happening. This is why the school refusal is happening. And here's directly how we can address it. Cognitive behavioral therapy uses a lot of those same behavioral principles and allows us to look at the cognitive or the thinking piece as well. Is my child worrying? Are they having negative thoughts? So these are all of those thoughts that may be really percolating for our kids and making it hard for them to attend school. And if they have anxiety, a big piece of the treatment is that we're going to be doing those exposures, and we're really going to be encouraging our children and teens to be brave. Go forth and do it. We know you can cope with it. We really want to send the message, we know you can do it. I know it's uncomfortable and you can do it. And for the mood piece too, really helping parents and their children and teens learn, even if you're not feeling like getting out of bed and you're really tired or you're just not feeling all that great, it's actually going to help your mood to stay in that routine and to get to school. A lot of the treatment that we'll do with anxiety and also depression too, or even just, like I said, depressive symptoms, is that we're really teaching skills and strategies to the parents to use with their kids, and also to, especially for older kids, but even some of the younger ones, like coping strategies that the child or the teen can use as well, to really get into school, make it a smoother process. If they get into school okay, to stay at school. And when to seek help. Obviously, if things have gotten to the point where your child is not attending school regularly, that's the time. Additionally, I think being able to look at seeking help as a great way to find an advocate to help you as parents and caregivers advocate with the school can be really beneficial. So if the school, it's their job to make sure kids are attending. Totally understandable. Absolutely get it. And I've had a wealth of experience in parents feeling very stressed and very upset about the amount of communication from schools about their child attending. Everybody's on the same team. We're all working towards the same goal of increasing attendance. That's a great time to seek help and say, okay, we're working on it. We're figuring out, why, Shauna's not attending school, and we're going to come up with a plan together. Another instance that you would potentially want to seek help is if it's really distressing for your child. I've worked with a number of children and teens who actually, they really want to go to school. I have a current case, and she is the most lovely child, and she feels incredibly guilty if she can't make it to school that day. So we've done a lot of work on being brave and getting to school, and also for her mood. She has had periods of depression and really low mood. We're also working on challenging some of those thoughts and saying, is that realistic? That you should feel guilty? Is that helpful? Things like that. So some of these complex cases can be really helpful to have that individual therapist when a lot is going on. All right. So it's a little earlier, but hopefully we have lots of really good questions.
Great job, Megan. Thank you so much. I actually didn't get any questions in the chat. So if you have questions about anything Megan spoke about, maybe she was just so clear, but we want to open it up. So please unmute yourself and feel free to ask Megan.
Hi, Megan. My name is Beth. I want to ask a quick question here about my 13-year-old son who has had school refusal apparently for years and also avoids class stuff ever since he was little. Will try to leave any environment that takes too long. So even like karate classes, he'd go to the bathroom like 3 times. He's been diagnosed with ADHD, so of course he has an IEP that allows him movement breaks. And I'm curious about your thoughts about balancing kind of anxiously leaving the class in a way that's not healthy and maybe necessary movement breaks throughout the day, and how a teacher can navigate threading that needle.
Yeah, that's a great question. And that's like a perfect example of how we really want to support kids when they need something like movement breaks. And even children who do not have ADHD, some of the plans that we may put into place at school include things like, when do you know when you need a break from class? How can we keep you in class? And also, we're recognizing that, sometimes kids just do need a break. So what we might do is say, okay, how can we really structure this and make it really consistent? So we might say, how many breaks are they taking right now? What's the baseline data? And how can we decrease that to get down to what we, and as a parent, for your son, and then also the school staff, what we consider like a good number of breaks for the day. Maybe it's 2, maybe it's 3, because we want to allow for those, and we want to make sure that it doesn't mean he's taking 15 breaks in a day. Because dude, if my son could do that, he totally would.
Oh, and mine does.
Yeah, he'd be like,
Yeah.
peace out.
Yeah. Yes.
I'm allowed to take these breaks. And you're like, yes, you're allowed. And if you're limiting it, maybe it's like 3 or something like that. It really helps them know, like, okay, I should use these when I really need them. And then if you wanted to add an extra layer of reinforcement onto it, you could really, obviously you can always praise the child for staying in the class. Great job staying in here. I could tell it was hard for you, and you might want, you might have wanted to take a break, but you didn't. Obviously for a kid like him, you probably wouldn't, and especially at 13, you wouldn't want to do it in front of the whole class. Maybe even the teachers just like giving like a thumbs up or something very covert. But you could also reward him, whether it's at the school and more immediate rewards, which is typically what we would recommend for a child with ADHD. The more immediate, the better. But you could reward him for keeping break passes. or whatever you used for the break. Oh, you only took one today? All right, you get a couple points, or you get, 2 Hershey Kisses, or something nice and simple, nice and immediate for remaining in the classroom instead of using those breaks.
Great. Thank you.
You're welcome.
So I actually have 2 questions. I used to work in a middle school with kids with like ASD and whatnot. And
thank
so
you for that.
Yeah, I was a para before I became a teacher, and now I'm working in mental health. So, I've sort of spent a path. But so I experienced with the whole like, rewards token system, right? Eventually the tokens stopped working. Like the kiddo was getting Pokemon cards if he made it through the day without having any big behavioral meltdowns, right? And eventually he didn't care about the Pokemon cards anymore. So it wasn't effective. And then one of the teachers ended up like going out and buying ice cream sundaes to give him. And he got pretty smart about it. And so he knew the like level of engagement he had to give to earn the reward. So like at one point, the only thing we asked of him was to sit in his speech therapy group and not flip the table and throw furniture, and then he would get an ice cream sundae. And so it was kind of like he almost started using the system to not have to comply. Because some kids are smarter than people give them credit for. And I saw that a lot, even with the kids that weren't on the spectrum. Anybody who was like, okay, we need you to put your phone away, like they'll find ways to get around it. So what's your thoughts on that?
Yeah, so we actually see that a lot. This would definitely be a case where I would say work, like if you're seeing that level of behavior, and yeah, kids are savvy, they learn how to get what they want. And I definitely think this would be working with an individual therapist that is very well versed in behavioral principles. What we often see is that, to answer kind of the first part of the question, when reinforcers really start to lose their effectiveness, super common, especially if you have a child with ADHD or executive functioning difficulties. It really keeps us as adults and caregivers on our toes. We have to re-up those systems. We have to make it fun and exciting again. You didn't mention this in particular, this is what I thought you might say, is that sometimes we can offer everything in the world, and it is not going to want to go.
It doesn't matter. Yeah, they don't.
Right. So there's something really to be said for being able to be as consistent and predictable as possible, so that kids are learning school's not really an option. The rewards and reinforcement are great. And for some kids, they're like, sweet, I'll go for that. Other kids are not going to be motivated by that alone, because the escape of not attending is so reinforcing. And so that's another case where we'd really want you to work with an individual therapist if your child is in that category, because we really have to close any loophole of missing school.
Gotcha.
The other piece of it, I'm trying to remember. Oh, yeah. So effective manipulating the system. So we would call that like meeting the standards of the system. And then what we would do is gradually, so like I mentioned baseline data before, we're always trying to look at where's the kid at now, and then how can we gradually, basically make the criteria more difficult. This is where they're at now. If we make it this much more difficult, can they then do that? So it is going to be, some of these systems are very gradual and do take some time. And that requires a lot of patience from families, a lot of patience from school staff. The child I mentioned that was really not attending and then was attending every single day, that took a good 7 months to get there.
I
And the
bet, yeah.
school was not always pleased with the gradual part of that process. And again, I don't blame them. Schools have a really tough job. I want to make that really clear. Teachers are amazing. They do a job that I don't want to do. And, being able to really work with teachers and school staff so that we're all on the same page is really important. Okay, see, I have a couple more questions. So the first one, you've said that understanding why teens are refusing school is important. Any typical clues you can offer in that assessment process? Because asking my teen gets me nowhere. Shocking no one ever, right? Teens are so hard to get through sometimes. So this is a good question. I mean, I think for a teenager, if I'm seeing more depressive symptoms, it may look more like fatigue, not getting out of bed. They could still be kind of angry and irritable, even if it's depression or like depressive symptoms. They can also be angry and irritable if it's anxiety. So there's a huge overlap in those symptoms. I think really looking at how your child or teen's functioning has changed, and if you're really seeing a change in how much they sleep, how much they eat, not able to get out of bed, really tired, then I'm more often thinking maybe this is a mood concern or like depressive symptoms. Whereas anxiety, it can impact those things, but it tends to look different. You might hear them saying worries like what if statements. What if I get there late? What if everyone looks at me when I walk in the class? So hopefully that answers that question. Bullying is a really tough one because that can look that's often, it could be that they're anxious, rightfully so. That's what we call a true alarm. It could be that they're having depressive symptoms for bullying. And if they're not sharing that with you, that can be really tough. Spending some extra time with your teen and giving them some space, but letting them know that you're there can sometimes get those kids to open up to you. Not always though, because teenagers. Another question, are you aware of any research on differences in school refusal patterns based on the school environment itself? For example, lower student-teacher ratios, smaller school, outdoors-based school. And this particular person is saying they have a child with ADHD and it's hard to know what school environment would work best for him. I've seen school refusal across all types of schools. I do find that in general, children and teens who enjoy school and enjoy the social interaction piece, enjoy learning, obviously those kids I'm not seeing school refusal come up as a concern. As far as the school environment, I do find that if the child is enjoying the school environment, that's the most important piece. And I think I'm trying to think, like, I don't know of any specific research on it. I think the biggest thing is like, obviously if the child enjoys the school environment, that they're much more likely to attend and less likely to refuse. Sarah, I don't know if you know any research on it in particular. Something we could look into, but I think the most important piece is that, and I think schools, especially here in Massachusetts, do a really great job at this. The most important piece is that the school is a positive, affirming environment. It's somewhere that the child can go or the teen can go. They feel safe. They feel heard. They have friends, at least one good friend. So if you're really seeing that your child is not making peer connections, doesn't have an identified staff member that they could say, I could go to this person if I need help, then those would be points of like intervention that we would take. Some of the children that I've worked with maybe were new to school and didn't have good friends and were never able to really make those friends because they were just attending so inconsistently. And so some of what we did was actually setting up play dates, or for older kids, like hangouts outside of school with some of the peers that they identified that they enjoyed. And that actually really helped them get back in the school environment too, because they felt like, I have friends I want to see there. I'm not just like on this island alone. Some kids I will recommend too, especially in this summertime. I know school's like right around the corner or already started for some families, but like I said, touring the school, a lot of kids I work with, I will ask that the child gets to meet their counselor or teacher, or both ahead of time, so that they have a familiar face and someone that they feel comfortable going to in the school. Because we really want that to be a positive, safe environment for them.
I think one of the things that's so hard to sort of generalize around a specific school is like every grade is different, every teacher is different. And so I think a lot of times it's really like, what's the readiness at the district level or the principal level? How much awareness and eagerness is there to learn about, behavioral health and to sort of accept consultation and the support of clinicians who might be working on this one-on-one with a kid. So, that school placement conversation of like, this is the type of, classroom or teacher environment that might be helpful for my kid, or these are the types of interventions that I've seen be really effective, in my work with their therapist one-on-one. When they're willing to incorporate that into school plans, whether they're formal or informal, I think that sets us up for the most success. But it really varies teacher to teacher, year to year, district to district. Any last questions for Megan that she can answer? So this is a really big and complicated topic, and Megan did such a nice job giving us a broad overview. We want to really emphasize that there's tons of nuances for every specific kid, and this can be really hard and challenging, especially if it's something you're going through with your kiddo, because they know how to push those buttons, and it's really hard to sort of stick with a plan without some extra support and consultation. So if this is something that you're struggling with, you've got our contact information here on the slide. We also have some social media links. We'll be putting out some social media posts on Instagram. And we have some blog posts that are on our resource page on our website. So if you want to know more, please reach out and follow some of those resources. Again, give us some ideas and tips for other things you'd like to hear talked about. And you can also find Megan's information on our website, since she's clearly a great wealth of knowledge about this topic. So thank you everybody so much for joining, and great job, Megan.
Thank you, everybody. I hope you all have a wonderful day. If your kids have started school or if they're starting school, best of luck to you. It's an anxiety-provoking time of year for us as parents and also our kids. So, go forth and be brave. That's what I tell all the kids I work with. Thank you, guys.